Hi, this is Eric Ruderman from Northwestern University in Chicago, and I'm coming to you from the EULAR meeting in Barcelona for Room Now. I've been looking at a lot of the abstracts on psoriatic arthritis at this meeting, and one interesting thing that I've seen have been some abstracts really looking in detail at using combinations of DMARDs to treat psoriatic arthritis. The abstracts in particular are OP0093, OP0106, and a poster 0106. What these are looking at is the idea of using combinations of conventional DMARDs rather than going to a biologic in order to get control of disease. It's not something we do a lot in the US, but I think in other parts of the world, either because of availability of drugs or because of their healthcare system that requires use of conventional DMARDs before going to a biologic, it's an issue that's come up a lot. A couple of papers have come out of the UK looking at an early inception cohort of psoriatic arthritis and looking at their treatment. They pulled out in one of those patients who were treated on two different DMARDs before going to biologic. And while on the one hand, it suggested that those patients did not always respond to DMARDs and many ended up on a biologic, it really is sort of a glass half full, glass half empty proposition because about 50% of the patients on a combination of methotrexate and sulfasalazine or methotrexate and leflunomide did well enough that they didn't need to take a biologic. I don't know that it's something we routinely do in the US, but it's certainly something that's a possibility, and it certainly raises the question about whether we really need to move straight to a biologic. The dermatologists often do that because of the control of skin disease, but for joint disease, we may do okay with combination therapy. Um, One of the abstracts here actually came from a Dutch study that looked at combining methotrexate and leflunomide. And they had presented that study previously, but at this meeting, they talked about some of the longer term data. And again, um, many of the patients did well, but about 50% of them had to go on to a biologic. And interestingly, it was the glass half full, glass half empty proposition because their conclusion was that that wasn't all that successful. So I think it depends on how you look at it. But in my mind, people switch off of biologics all the time. So patients who do well 50% of the time, that's not a bad track record. And I think in many cases, it may be worth at least thinking about combining DMARDs and not going straight to a biologic. Certainly for cost reasons, that makes sense. It's challenging these days, certainly in the US, when biologics are more available and patients want to go straight to the target. So that may be a difficult proposition to persuade them as we talk to them about it, but certainly worth thinking about. Anyhow, that's one of the issues I'm seeing here at the meeting at EULAR in Barcelona. And again, this is Eric Ruderman coming to you from Room Now.